Hello and welcome to Adhesives Made Simple, a clinical guide to choosing the correct adhesive. I'm really excited today to be presenting this program on adhesives and to give you a strategic knowledge about what adhesive to use and in what clinical situation. I don't want to teach anybody how to use an adhesive. You all know that. What I want to do is give you the strategic knowledge to choose the correct adhesive and to understand why you're using the adhesive you're using in certain clinical situations. I also want to thank Dentsply Sirona. They're sponsoring this program today, and I want to thank them, one, for sponsoring the program, but also for manufacturing materials and technology that are so relevant to dentists today. It's a wonderful company, and I'm proud to be a part of presenting this program for them today. And I use many products that they offer. So let's get into this. My name is Dr. Sam Simos. I'm a general dentist that has two practices just outside of Chicago, Illinois, and I do what you do every day. I do implant, restorative, and cosmetic dentistry on a very high level, and I'm happy to share that with you and learn from you as well. So follow me on Instagram. I learn a lot of techniques and technologies on Instagram, and I hope that you will too through my Instagram page. It's Dr. Sam Simos. So today when we're talking about adhesives, my program is going to focus on these major areas. One of them being the fundamental mechanisms of bonding. And what I want you to do is to just think about how you use your bonding agent. I want you to think about what you use, what kind of adhesive you're using, because there are different kind of adhesives, and I think that we seem to be, falling asleep at the wheel sometimes when we use these materials. We need to know what kind of material we're using in certain clinical situations. So we're going to look at that, and we're going to look at the fundamentals. The next thing we're going to be doing is looking at the categories of adhesives that you use. When I'm showing you the different categories of adhesives, I'm not doing this so that you understand what your neighbor's using. I want you to understand what adhesive you're using, and then maybe what adhesive you should be using. Someone asked me many years ago, why do you use the adhesive you use? And you know what? I didn't have a good answer for them, and that's kind of how this whole program came about. Look, I want to have a reason for the materials that I use. So I want you to understand the fundamentals, the categories, and then we're going to talk about the efficiency of adhesive diffusion, because that's a really important factor. We can't just slather on this adhesive and expect it to work. It's not Elmer's glue. There's a chemistry involved here, and we have to know what it is we're doing. The next thing I want you to understand is that no matter how great of an adhesive you're using, no matter what category of adhesive you're using, there's always a limitation to any adhesive that's on the market. So we're going to talk a little bit about that so that you understand that as well. And then once we have all of this knowledge, all of this information put together, we're going to then start asking ourselves, well, what kind of adhesive do we want to choose for the correct clinical situation? Indirect, directs. We use adhesives for so many things that we do in dentistry today that a lot of our success is dependent on using this adhesive correctly, and there's a lot that goes into it. So we're going to try to put everything together, and hopefully this will be a great hour-long presentation for you, and you can at least pick out some gems that you can take back and use on chairside. Next, we're going to talk about the different categories of adhesive. One, so that you understand what's on the market today. The other, so that you understand what kind of adhesive you're using in your office today. Because a lot of times the clinical situation dictate that we use a different kind of adhesive. So let's talk about the total etch or etch and rinse. These come in two different categories. A three-part system you see on the left side of your screen, which is the etch, the primer, and the adhesive, all in three separate parts. Some people refer to this as fourth generation. On the right side of the screen, you see the two-part system, which you have an etch, and then the primer and the adhesive as in one bottle. And that some people refer to this as a fifth generation. The self-etch category of adhesive also has two different categories of adhesive. The two-part system where the etch is incorporated into the adhesive. Some people call this a sixth generation. And then you have a seventh generation where the etch, the primer, and the adhesive are all in one bottle. Now, the nice thing about the seventh generation is that there's also a universal category. And the consumer has to be aware, the dentist has to be aware of this because not all universals are created equal. I'm going to be talking today about Prime and Bond Elect from Dentsply Sirona. Prime and Bond Elect is a seventh generation universal, which means it gives me total freedom clinically, given the clinical situation. Whether I have a little bit of enamel and a lot of dentin, or whether I have a lot of enamel and a little bit of dentin, I can use it in three different modes: a selective etch, a total etch, or self-etch. So this is a nice situation to have because I can have the freedom that I want clinically depending on the clinical situation. I don't have to have multiple adhesives in my office. I can just use the seventh generation universal. So I'm going to give you a little bit of a taste of videos of how these are used. This video is by Dr. Ron Jackson. It's a three-part system. This takes a lot of time, and many times today, with today's dentistry, we just don't have the time it takes to use these fourth generation or three-part total etch systems. It just takes a long time because you have to treat the tooth correctly in order for these things to work correctly. So I'm not going to let this go to the end. You just have to know there's a lot of time involved with these fourth generation. In the next category of adhesive, these fifth generations, yes, it's a little simpler, but you have to be very careful because these are sensitive. When you put the etch onto the tooth and onto the dentin especially, and you desiccate the dentin, which most of us will do, it can cause some sensitivities. So these fifth generations might be a little bit easier to use, but again, there's some problems with these as well in using these. And I want to eliminate as many problems as I can with my adhesive. With the self-etch, the sixth generation, the two bottle systems, I have to be careful that I'm etching the enamel correctly and long enough. And sometimes I just don't have the confidence when using a sixth generation that I'm etching the enamel well enough to get a long-lasting seal on the enamel. I know it's etching the dentin well enough, but I'm just not quite there that it's etching the enamel. So you have to really scrub these in and be very, very careful about how you're using these. And a lot of times the clinical situation, again, doesn't dictate or that we can use these. In the seventh generation, especially the seventh generation universal, like the Prime and Bond Elect, if I have a lot of enamel around my restoration, like in a class 2 or class 1, I can use it in a selective etch mode. I can even use this in a total etch mode. Or if I'm doing a indirect restoration where I'm cementing a crown and I don't have any enamel around the margin, I can use this in a self-etch mode where I don't need etching at all. So this is a nice category to give me the freedom that I need, and it's a lot quicker than any of the other adhesives that I've just shown you. All right, so now we're going to move on, and we're going to talk about these. Now that we have a good idea about the different categories, we're going to talk about a little bit about the mechanisms, about how they work. The fundamental mechanisms of bonding to enamel and dentin is based on an exchange process, whereby using these acids on the tooth, we remove minerals and we replace them with a resin monomer that when we polymerize this monomer, they become micromechanically interlocked into the porosities. Now we can do this through a mechanism of an etch and rinse, a self-etch, or a glass ionomer kind of approach. The important thing to understand when we're talking about this success in the mechanism of the way that we're doing this is the longevity of the adhesive restoration is dependent on the quality of the formed hybrid layer within the smear layer. And a lot of times the smear layer is lost. And historically, we've treated the smear layer so different. And we're going to talk a little bit in the next little bit about the hybrid layer and the smear layer, because when we're talking about adhesives, it's important for you to understand that this is where the action takes place. The hybrid layer and the smear layer is where the rubber meets the road. We need to treat this layer correctly in order for success and longevity to happen. A lot of times we can do everything correctly, but if our adhesion isn't done correctly, then everything fails. Okay, so let's talk about the smear layer. The smear layer is sometimes referred to as a freshly cut surface debris. Sometimes it's referred to as a biologic Band-Aid. And it limits the bond strength, but it's porous and it reduces fluid flow from the underlying dentin. So the smear layer has been treated historically different. Way back when I was getting out of dental school in the early 90s, we used a glass ionomer approach. The early adhesives modified or attached to the smear layer. And so this is very different than where we are now, because we've gone to these etch and rinse, where when we put this phosphoric acid onto the dentin, what happens is that we remove the smear layer completely and we have demineralization of the intertubular dentin, and then we have to replace that, right? So now we've come, the current self-adhesive adhesives are they're self-etch. So we've removed the etch and incorporated it into the smear layer, and what happens is that creates a simultaneous diffusion into the dentin, and it creates a nice situation. We're going to talk a little bit about that, but historically we've treated the smear layer very, very differently depending on what kind of adhesive or what generation of adhesive that we use. So now that we understand the smear layer, I want to take a closer look at the adhesive mechanism, the actual adhesive mechanism. What are we doing when we put that material onto the dentin and the enamel? Well, here's what's happening. And you can see inside this pink box that we have, on the bottom of the box, we have the dentin or the collagen tubules. On top of that, we have what we're trying to create in the hybrid layer. And then we have the rest of the adhesive resin on top. And then on top of that, we'll put the composite. And this is how we get our adhesion, right here in the hybrid layer, right? So what we're going to do is we want to take a look at what is happening in this layer. Well, what happens is that the bonding agent penetrates the vacancies to fill this peritubular dentin. And of course, the bonding agent, in order to fill these vacancies, relies on that collagen being moist. So we rely on moisture within that dentin or collagen in order to get penetration. But we also rely on something else, and so that something else is light, right? Because we can do everything correctly, but the problem is if we don't have the correct light conversion for this hybrid layer, then all bets are off. Everything goes down the drain. So we want to make sure that we have a nice curing light and technique used in our hybrid layer so that we can develop this hybrid layer correctly, right? Because everything is based on the hybrid layer. All of our success is based on the hybrid layer. So we want to have a good curing light to facilitate this. I think that all curing lights are blue, but definitely not all curing lights are created equal. So often I'll go into a clinician's office and they will be using a cheap curing light that really has no power. Sometimes I see halogen curing lights that's using a halogen bulb. You need an LED, good quality curing light. Because if you don't have that and you have undercured adhesive, all bets are off. The success goes way down. If you had undercured resin, forget it, all bets are off. The success rate goes way down. And when you have undercured adhesive and resin, the bond strengths are pretty much out the window. So no manufacturer recommends undercuring resin or undercuring adhesive. every manufacturer recommends a complete cure of your resin and adhesive. And so this is where I would just wanted to deviate a little bit and let you know that curing lights are a big deal. And there's so much written about curing lights, and we won't go into that in this lecture, but I do want to emphasize that this is a big part of the success of your adhesive, is a curing light. Okay, so moving on, how does an adhesive penetrate? Well, an adhesive has a carrier or solvents within the monomer. And these can be water, ethanol, or acetone. And most of the time in these self-etch adhesives, they're mostly made of water. In the total etch, we depend on ethanol or acetone to carry these monomers into the dentin and fill those peritubular spaces. So this is our mechanism, and this is how the adhesive penetrates. So let's talk a little bit about that. In a total etch or an etch and rinse category of adhesive, efficient diffusion happens when the dry dentinal surface is replaced by the resin monomer. But there's a problem here, or there's a potential problem here, right? Because when the water, remember, we want that collagen to be moist. Well, when the water inside the collagen network's not completely displaced, then the remaining water competes for the space within the resin with the resin inside the demineralized dentin. So we have to be careful here because, if you look at the picture of this beach up on top right, we don't want the dentin to be really, really wet, like in the blue area, and we don't want it to be really, really dry, like in the sandy area. We kind of want it to be really moist, like in the middle. And that's a challenge a lot of times because clinically, sometimes we can't see if it's moist, sometimes we can't see if we have puddling, sometimes we can't see. And so because this type of adhesive, these total etch adhesives, are made up of not a lot of water, we can't re-moisturize that dentin, we get a lot of problems. So there's a challenge with a total etch. Now, in the self-etch category, there's a little bit more of a benefit because the conditioning or the demineralization and the priming happen simultaneously to the same depth, and you ensure complete penetration of the adhesive because of the way that the chemistry happens, because of the way that these seventh generations are, these universal adhesives are constructed. We have a complete penetration of the adhesive, and that's a benefit. And I like that about these seventh generations adhesives. Now, as I said at the beginning, there are limitations associated with all adhesives. Some limitations are that we can bring upon sensitivity. Other limitations are that we can have an inhibited dual or self-cure resin in our resins. And that's a problem too if we're using a post or if we're using a buildup, a resin buildup. Next, we can have a thickness problem of our adhesive. Some adhesives are extremely thick. Some adhesives, we can have poor enamel etch. We've talked a little bit about that. We're going to get more in depth. And then we create MMPs, or matrix metalloproteinases. And we're going to talk a little bit about all of these limitations, but all of the bonding agents out there have some sort of limitation. And I want you to be aware of that because what we're going to do in this next section is we're going to talk about the way to mitigate some of these limitations in all of these bonding agents. So let's talk about the different limitations. Limitation number one, well, we have the reduced enamel etch and adhesion of the self-etch. And this happens in the 6th and 7th generation, these self-etch adhesives. Well, why does this happen? One, because we've put the enamel, we put the etch into the chemistry. And normally, you see the SCM on the left, the phosphoric acid etches the enamel really, really well, right? But you can see that in the 6th generation, this middle circle here, that the enamel's etched okay, but definitely not as well as the phosphoric acid etch, right, on the left. And then we go into a 7th generation where we almost get no etching of the enamel just from the adhesive itself. So they're mildly acidic, they're lower etch quality, and they have a lower enamel bond strength. So it requires enamel etching in the 6th and 7th generation. So let's talk about how to mitigate risk, right? Well, what do we want to do with these? What's the solution? Well, because we can use a selective, total, or self-etch with the 6th or 7th generation, I would say stick with the selective or the total etch with these adhesives. That's one solution. The other solution is make sure that we have enough agitation within the dentin and enamel when we're using these, because when you render contact of these fresh acidic monomers with the tooth surface, you get more penetration. Okay, so make sure we use these adhesives properly. The other solution that we can have is that we want to understand the etch times. When we're using a selective etch or a total etch technique, there's a big difference between unground at 30 seconds and a cut enamel at 15 to 20 seconds, and then a dentin leaving that etch on for 3 to 5 seconds. So we want to make sure, like Dr. Jackson did in that first video, where we put the etch around the cut or uncut enamel first and then drop the conditioner in and be ready to take it out right away, the conditioner. Here's another limitation: bond incompatibilities. This is a very misunderstood limitation of adhesives. And what this is happening in is our one bottle adhesives, whether it's total etch or self-etch. And in these one bottle systems, what happens is you can have bond incompatibilities. Think of the blue box you see on the bottom of your screen as the tooth. And what happens is that we paint the adhesive onto the tooth and we light cure. And what happens is we get this uncured acidic monomer that is on the top of our adhesive. Now, we don't see this. It's not shiny, it's not smelly, nothing like that, but it will affect our self and dual cured resin cements, or our core materials, when we're using them for buildups or for posts, whether or not we're using them for cements for metal crowns or for porcelain fused to zirconia or zirconia crowns. All of these self and dual cured resin cements, if they're incompatible with your adhesive, you'll have a problem at the interface of your adhesive and dual cure self-cured resins. So be careful with that. And here's how to mitigate the risk. Well, first is to understand it. And I wanted to just bring it to your attention that the American Dental Association had this information back in 2010. They said adhesives compatibility with the core material or the dual cure or self-cure resin cement is the main issue. Although some manufacturers have better adhesives to match with their core material or cement than what they package with the product or recommend, sometimes the recommendations don't quite match even their own product line. This is a big indictment for this particular problem of adhesion. Well, again, what we want to do is we want to be able to know that our dual cure self-cured resin is compatible with our adhesive. Here's the way that I do it. I'm an evaluator for Dental Advisor, and so I get a lot of adhesives. I get a lot of dual cured self-cured resin cements, and I want to make sure they're compatible. So what I'll do is I'll take a piece of tinfoil and I'll coat it with my adhesive that I'm going to be using with the dual cure or self-cure resin cement. I'll put the dual cured resin cement on the adhesive and fold on this tinfoil and fold the foil over and wait for about 6 minutes for it to self-cure. If I take the tinfoil apart and I see that there's some squishiness in the material, or I see that on the surface between the foil and it sometimes doesn't look like this gooey. Sometimes it'll be just sticky. Then I know it's not compatible. When I see that it comes out in a nice chip and everything is nicely, completely cured, then I know that I've got a compatible adhesive with my dual cure self-cured resin. So the solution is to understand your adhesive. What category of it? Is it compatible with your self or dual cured resin? And then, am I using it in the proper clinical situation? I cannot bond to a wet or bloody environment. And then, do I need a dual cure additive with my adhesive? The problems that I will have clinically. Another limitation is postoperative sensitivity. And postoperative sensitivity happens in the total etch 4th and 5th generation adhesive. And what happens is that we want the collagen to be very fluffy and moist, right? But when it's over dried, what happens is that collagen collapses and the adhesive can't penetrate, so you get sensitivity. And this is a problem, and this has been a problem for a long time. And so when some clinician comes up to me and says, well, I'm using, this total etch adhesive and I'm getting sensitivity. I will always ask them how much they probably over desiccate the tooth. Sometimes they're not using a rubber dam. So this is a really big problem. How do we mitigate this risk? Well, consider the beach, right? We don't want to have the dentin be too wet. We don't want the dentin to be too dry. We want it to be moist, that middle section, right? So that's the kind of thing we need the dentin. It's very difficult to achieve, but we definitely don't want any puddling, and we don't want to over desiccate the dentin. The next thing is we definitely have to understand our etch times, because if we over etch the dentin, we can again create sensitivity. Another limitation is excessive film thickness. And this happens because in the 4th and 6th generation, these 2-bottle systems, they're very, very thick. So it can really, because of the high viscosity and because of the lack of solvent and the higher filler loading, it really limits your indirect use. And you have to be very careful when you use these because they're so thick. So how do we mitigate this risk? Well, we need to blow the adhesive thoroughly, and we might need to make sure that there's no puddling. This happens usually through either wiping it with the applicator or blowing it really thoroughly, so we have no puddling in the tooth. Another limitation is MMP formation, or matrix metalloproteinase formation. These are enzymes activated by the acid that we use, and it consumes the collagen layer. There are many, many papers that illustrate and document the formation of MMPs because of the acids that we use, and there's no way around it. It's in there. It's done. It's definitely well researched. The problem is that these MMPs, they can weaken the bond. You can get sensitivity. You can have debonding or bonding failure. And this happens in all adhesives because we use etch or acid with all of these adhesives. And what happens is that because of the introduction of the acid, you get these MMP formations within the collagen. And some literature says that within 3 months, the bond is decreased by sometimes 30%. So it's a big problem. How do we mitigate the risk? Well, we can use a chemical called benzalkonium chloride or chlorhexidine. Benzalkonium chloride is embedded in a etch called Uni-Etch from Bisco. And so sometimes I'll use a total etch technique just to introduce the benzalkonium chloride, or the BAC, into the dentin. Conceptus rinse, you saw Dr. Jackson using that very well. I use this a lot as well. It's a 2% chlorhexidine rinse or scrub. And you can also use Cavity Cleanse from Bisco. This is a 2% chlorhexidine scrub that you can use after you etch, and it will help mitigate these MMP formations. So at this point, you know a lot about adhesive. You know about the fundamentals, the different categories, about how an adhesive diffuses through the dentin, limitations of all of the adhesives on the market, and how to combat some of those limitations. So now you should be able to select the adhesive for your clinical situations that you're in. One of my go-to adhesives and what I like to use is Prime & Bond Elect. It's a universal dental adhesive. It's a 7th generation, 1-bottle universal adhesive. I get no sensitivity. It's got an acetone and water carrier in the monomer. And as you know by now, the diffusion with this is wonderful. It's excellent. It's easy to use. It can be used in all etch techniques, whether it's a self-etch, selective etch, or total etch. It gives me consistently high bond strength. So it gives me the freedom to choose clinically where I can use this. I can use it in any clinical situation. It's compatible with the dual cure and self-cure core buildup cement materials because it has a self-cure activator. I don't have to worry about compatibility with any dual cure, self-cure buildup material. And the dispensing is very easy. It's either a bottle or a single-use dispense, and so it ticks off that sheet as well. So I find myself using this over and over and over again. I have many adhesives in my office to choose from, but I go with Prime and Bond Elect for the majority, if not all, of my adhesive needs. I wanted to mention another thing that makes it easy for our team to keep track of, and we're using more and more dual cure resin cements, is that when I have a retentive crown that I'm putting on, I like to keep the adhesive and the dual cure resin cement from the same manufacturer. And I love using Prime and Bond Elect with Calibre Ceram because it just makes the process easier. Easy to clean up, easy to cement, and the bond strengths are excellent. So here's what I like to do and how I like to use Prime and Bond Elect with Calibre Ceram. I don't need a self-cure additive if I'm light curing before or after I place the crown. So what I'll do is I'll clean the tooth, put Prime and Bond Elect on the tooth, blow it dry, light cure it, put the Calibre Ceram into the crown, seat the crown fully, and then I'll tack, cure, buckle, and lingual for about 3 to 5 seconds. I'll clean it up. Clean up is a breeze. I clean up interproximally and buckle lingually. And then I'll go ahead and I'll do a 20-second cure on the buckle, 20-second cure on the lingual, 20-second cure on the occlusal. And that's it. Check the margins again. You're all done. It's a great way to cement a crown very, very easily with very little fuss. Because when we go to select our adhesive, I want you to think about, and I've sat down and I've created this adhesive decision tree, whether or not you're using adhesives in the direct or indirect or anterior or posterior. I want you to think a little bit about the different problems that you have and then the different adhesives you have to solve those problems. So let's just take the direct posterior, something that we've been talking about. And some of the problems that we could have is light accessibility, moisture, bleeding, time, composite, or dual cured resin. And all of these can be different problems for different clinical situations. Well, all roads lead to the 7th generation adhesive. Now remember, I'm using 7th and 8th generation as one. I could also say universal, but all roads lead to these 7th generation adhesives. And I want you to be aware of this because no matter what problem you encounter in the mouth clinically, these 7th generations are really going to be a friend to you. So if I have bleeding, I'm going to use an aluminum chloride hemostatic agent. I don't want to use a ferric sulfate hemostatic agent because that kills the bond. So I want to use an aluminum chloride. Hemoband gel is a great one that's very nice. It's a Dentsply product. And it's like a 25% aluminum chloride, which stops the bleeding immediately. So it's very, very good. Now, again, we want to make sure that, this is just a little cheat sheet that I use, but again, all roads point to the 7th generation. I've almost stopped using the 4th and 5th and 6th generation in my practice just because 7th generation takes care of everything. So, thank you very much for your time. I appreciate you listening. I hope you've picked up a few gems along the way. And again, please follow me on Instagram and see what we're doing in our office. And you can pick up more tips and techniques for your office, I hope. Thanks very much and have a great day.